everybody. My name is Josie, and I am presenting the Chagas disease. So, Chagas is a protozoan parasite, the Trypanosoma cruzi, and is also called American trypamoniasis. It is commonly found in the Americas, but it's also prevalent in rural areas of Latin America. It's estimated about 8 million people in Mexico, Central America, South America, have Chagas disease, though most of them who have it don't know they're infected. And if untreated, the infection is lifelong and can be life-threatening. So this is a really serious topic. The primary vector is the tridamine bugs. They're also called the kissing bugs. The bugs will get infected by T. cruzi by biting an infected animal or person. And once infected, the bugs pass the parasite through their feces. So that's really fun. Reservoir hosts are armadillos, opossums, raccoons, wood rats, some rodents, domestic dogs, humans, just a variety of mammals. Vector bites are the most common. The most common scenario is that after getting bit by the bugs, they'll poop on the person and they become infected if the bug feces enter through mucous membranes like eyes or breaks in the skin. They're called kissing bugs because if they get bitten at night, which normally happens, it's like a little kiss on the face and then they rub it in their eye, and that's how a lot of people are infected. Some less common exposures are oral exposures, like ingested of contaminated acai, palm fruit, sugarcane juice. And then there's a bunch of other exposures like blood transfusions and organ transplants. There are two phases of Chagas. There's the acute phase, which lasts from a few weeks to a couple months. In this phase, people can have little to no symptoms, and even if they experience symptoms, they can start to feel better even while they're still infected. So the most common symptoms are the Ramona sign, which is the swelling of the eyelid from rubbing infected feces in the eye. And other common symptoms are really vague, like fatigue, body aches, headaches, rash, loss of appetite, diarrhea, vomiting, and in some cases, possibly mild enlargement of the liver or spleen or swollen glands. And the chronic phase can last from a couple decades to their whole lifetime. 30 to 20% of infected people develop chronic symptoms. And the chronic symptoms are cardiac complications like enlarged heart failure, altered heart rate or rhythm, or cardiac arrest, and gastrointestinal complications like an enlarged esophagus or colon, and difficulties eating or pooping. And then I found this graphic, which was really interesting about the path of the infection, how it goes from infection to diagnosis, symptoms, and clinical management or cure. And I thought this quote was very interesting, given that approximately 30% of the patients in the chronic phase will develop severe clinical forms of Chagas disease, which often lead to death. Clinical management is crucial. Basically, impacts on the population, the symptoms are pretty severe if you get them. It is endemic in 21 countries in the Americas. There's an annual incidence of 30,000 new cases on average, 12,000 deaths per year, and approximately 9,000 newborns become infected during gestation. A disproportionate effect Chagas has on poorer people or who have no political voice or access to healthcare, and 75 million people are currently at risk of infection. The immediate response to Chagas is detection and treatment. Detection in the acute phase is really rare just because of the nonspecific symptoms and the asymptomatic cases. If infection is detected, there is a treatment efficacy of 80% by killing the parasite through an antiparasitic medication. There are two different types, and the efficacy of both types of antiparasitics diminishes the longer a person has been infected, and adverse reactions are more frequent at older ages. The main policy outcome for Chagas is the Southern Cone Initiative. There are 6 Southern Cone countries: Argentina, Bolivia, Chile, Brazil, Paraguay and Uruguay. Their two main objectives: to improve blood screening and eradicate all populations of the primary insect infector. The attack phase of houses will thoroughly treat with insecticides. And then there's a vigilance phase where households report any findings of bugs in the area, so then selective treatment and spot spraying can be organized. And then the Southern Cone Initiative also implements a large-scale screening of blood and organ donors to stop transmission that way. And remarkably, the Southern Cone Initiative has had a lot of success with transmission halted in vast areas of previously endemic regions. And Chagas is actually ranked as the most serious parasitic disease in the Americas, with an economic impact far outranking the combined effects of parasitic diseases like malaria, schistosomiasis, and leishmaniasis. There's obviously a large impact on the population's physical health with the symptoms, regulation on housing, requirements of spraying, and building materials changing to make sure an infestation is less likely. The screening for Chagas in blood and organ transplants, and of course, spraying insecticides in homes and around the homes can cause additional severe health outcomes. And April 14th is actually World Chagas Disease Day, and they normally have a yearly theme. So I thought it would be interesting to look at last year's theme and this year's theme. Last year's theme was increasing awareness of Chagas disease and on providing access to crucial care and implementing disease surveillance at the primary healthcare level. This is really important because most people who are impacted by Chagas do not have access to primary health, anything further than primary health care, if they even have access to that. And then this year's theme is necessity for early diagnosis and lifelong follow-up of the affected people by the disease. And these are my citations. Thank you.